Hi everybody. I'm super excited to introduce you to one of my teachers, Lynley Murphy. I've had her for a couple of classes and I've absolutely loved being one of her students. She's amazing. Just a little bit about her. She's married to the amazing Alan Murphy and they live in South Jordan. She has a really cute cat that you get to see later in the video, but they also love to travel, downhill ski, ride motorcycles, cook. It's super fun. She has been at UVU for 18 years. And she has gone to so many places over the world. One of the places she's gone is Ghana, and she's done work with HIV and AIDS in education. And right now she's helping run a program for students K through 12 that deals with like mental health, and is a way to prevent bullying and making people feel like they have a place and that they belong. And you can check them out at goldengatemovement.org to find out more. But I'm super excited to show you our interview. We talked a lot about women's health, which is something that she's super passionate about, and I'm excited for you to see. I hope you enjoy. So I'm here with Lynley Murphy from UVU. She has been one of my teachers since I started in the public health program, and I have absolutely loved your classes. You have always been one of my favorite teachers and have helped me a lot to understand different aspects about health. I've taken human diseases and international health with you, and I absolutely love those classes and learning about the diseases and then learning about global things. It's been awesome. So
and Hannah's a great student, everyone. So you know.
Thank you so much. Perfect. Well, let's get started. How long have you been at UVU?
So I've been at UVU for 18 years now.
Nice.
So a long time.
There we go. It's awesome. I love it. And what sort of got you interested in women's health?
I think since I was a child, my father has always been really an advocate for women, and he's a pretty amazing man and great example. So my mom put him through school, and then they had their family. So there were 4 brothers and 1 sister, and my dad always really pushed my sister and I to do as much as we could. He would always say, you can be anything you want. And then he would encourage my mom to go back to school. So she did over time. And I think just watching my dad encourage women in his life, and then watching my mom, she got a master's degree over the years and taught at the community college and studied European art history. And she was a strong woman. And I think through a lot of the things that she did, I learned that I wanted to be a real advocate for women. Like that's one of the examples. Yeah.
Yeah. I mean, it's awesome. I mean, I feel like women definitely need advocates. Like we're strong and we can do whatever, but it's nice to have a little bit of encouragement to do so, because I feel like a lot of in society can kind of make us feel like we can't do a lot of things. So it's nice to have that encouragement.
And so I was just going to say, secondary to that, I think, when I served a health and welfare mission, I was just 1 or 2 classes shy of getting a health degree. And then I served a health and welfare mission in Bolivia. And we did like, just all these, like we did commercials on TV in Spanish about how to improve the health of your home. And we did fairs, health fairs, and a lot of stuff and I watched the difference. There's some gender differences between the value of men and women and the differences. And I think that really also made me want to be an advocate, like stand up for the woman who is a little disenfranchised. Yeah. So that was a strong effort.
Oh, that's so cool. I love that. Yay. Perfect. And then, so you talk about you went on that mission to Bolivia. What other kind of work have you done with women's health? I know you've gone a lot of places internationally. What kind of have you done to help advocate for women's health?
I spent 3 summers in the Dominican Republic, and I worked with women, specifically women who had limited literacy skills. And so they were at or below a 5th grade reading level, which is called functionally literate. And so I worked with women to educate them on the dangers of, well, most women in this area, there was a child per family that had died from dehydration and diarrhea. And so sanitation was a huge issue, hygiene. And so I worked with them to we had a program that we developed, an educational program on sanitation, hygiene, pregnancy risks, and the importance of breastfeeding. And so for 3 summers, I worked with those women, and it was just a phenomenal experience. They were amazing. Yeah. And so that was kind of what got me into the international, wanting to do more internationally. And then someone I worked with in the Dominican Republic invited me to come to Africa and test some materials that they had developed. So that's how I started going to Ghana. So
awesome. Yay, super cool. Has kind of been, I know you've done a lot, but what has kind of been your favorite project so far? What do you think like you've loved doing the most, if you can pick one?
Oh, something that was very satisfying to me was teaching in Africa. So going to Ghana, and we would teach my students would pair up, and we would spend a semester preparing all the curriculum for all these different health lessons and anatomy, anything at all. And then my students would pair up, and in the mornings we would teach in the schools. And it was a poor school, which is very relative when you're talking about Ghana, because it's a developing country, and so it's relatively poor. So, but we worked with a school where most of the kids didn't have both parents, or there were some real difficult issues, and that was so much fun. And then in the afternoons, we would teach HIV/AIDS classes to what was called the Cocoa AIDS Council, which was basically all of the organizations in the country that worked with youth. And so like the YMCA and the YWCA and the Red Cross, and just we would go to these organizations and we would teach HIV education and prevention. We also got to teach the Ghanaian soccer team, which was crazy.
Oh, that's awesome. I love that.
It was a very, very fun experience. But yeah, I think that probably has been my favorite experience. In the evening, once a week, we would go to an orphanage and just work at an orphanage. And it just was so fulfilling and so fun. And they really, we did a pre-test of what education attitudes and knowledge they had before we started a 2-month education program with them. And part of the HIV prevention was also about gender, relationships and gender differences, and the issue of rape, and a lot of things that women would experience, and it had a lot to do with where they stood in society. How they were considered kind of second-class citizens. And so it was a really beautiful experience, because most of the time the male students in my group would teach the importance of women in society, that lesson.
That's awesome.
And it was always a really neat experience. So that's probably been the most fulfilling for me, is just working with all those people.
Oh, I love that. That's so awesome. Thank you. And then once COVID, we can go and do things, and it's a little more accessible. Do you have anything planned in the future that you're wanting to do, that you can go and work with women's health, or work in different parts of the world, or maybe here locally? What are your plans for?
So
after
me and another faculty, Melinda Barber, we're planning on going back to Ghana to try to see over time what knowledge and skills were sustainable.
Cool.
But then I'm also working in the high schools, middle schools, and elementary schools. I've worked with a team of educators and other people who we've developed a program called the Golden Gate Movement, which it teaches pro-social skills and creates a place where everyone is accepted and wanted. And it has an amazing story in the background, and I'm sure we don't have time for that, but I definitely have everything in the school. So I was going into the schools and collecting data from students, surveying them on their greatest fears, challenges, and worries when they come to school. And then we were trying to figure out, with the knowledge we gain from these surveys, what can we teach in the Golden Gate Movement organization to help strengthen their ability to manage some of these challenges or deal with them. And so, I'm super anxious to get back. We're still moving. We have about 40,000 students right now, but we're still growing. But all the research has been put on hold, because the last thing that the school needs is a disturbance in their day, which is already crazy.
It's already super wild and crazy right now. So hopefully we can get back to sort of a new level. We can figure it out, and we can get back in there and start helping this. That's awesome. So then to kind of talk a little bit more about like obstacles that women face, I want to talk a little bit more about like locally and then go a little bit more global. But I mean, here in Utah or maybe in the United States, what are some of the biggest obstacles that affect women locally, would you say?
Um, I think misunderstanding in maybe their value
Mm-hmm.
and seeing themselves and the potential that they have.
Yeah.
I feel like that seems to be kind of a chronic problem in society in general.
Yeah.
But I mean, you really don't know what your potential is until you're pushed to your limits, and then you realize a new potential. And I
Yeah.
think in a lot of ways, women locally maybe have not been pushed to try to reach their potential, if that
Mm-hmm.
makes sense.
Yeah,
And
no, yeah.
I don't mean to sound critical. It's like I said, I think it's uh, across the nation and globally. Like I
Yeah.
think abroad, I mean, I'm I've watched for years how frustrating it is because a lot of the mothers who have such a powerful influence on the health and well-being of their families
Mm-hmm.
globally, they don't make it past elementary school because once they start menstruating, they drop out of school because there's no sanitary place to take care of themselves. And so they fall
Yeah.
behind and then they drop out. And according to how like the trajectory that we're on right now, it will take until, I wrote it down, 2086 until all girls just in Africa have the opportunity to attend secondary education.
Are you serious? That's
Yeah, so
crazy.
it is. And in the next few years, it's estimated that 15.5 million girls will be married as young girls,
Oh
not
my
as women.
goodness.
And so, again, not being able
Yeah.
to really have the opportunity to see their potential or to just become who they could be.
Yeah.
And globally, I think culture has a lot to do with that. The roles of
Yeah.
men versus women, the gender,
Definitely.
gender
Ugh,
inequity has a lot to do with that. So,
absolutely.
yeah.
Are there any programs like locally that you know of that can help women to maybe like achieve that potential or realize that they're capable of so much more or kind of give them the opportunity to do some of those things?
There's quite a few nonprofits where
Uh-huh.
women can, but I think that's interesting because women have to see in themselves like, I want to try to do more. And then they can
Yeah.
look online and find lots of resources. It's
Yeah.
not something that's taught in schools, like this
Yeah,
is
not
something you should
really.
look at, or
Yeah.
yeah. So I feel really grateful that just growing up, my father really pushed that in to the girls in the family. Like,
Absolutely.
yeah. And sometimes I'd be like, I get it, Dad, like
You're
enough.
like, thank you, I can do this.
Yeah.
Perfect. I love that. And one of the programs that I feel like I've heard a lot about in my classes is the Wic program. I feel like that's one thing that I've heard a lot about. Can you kind of explain what that program does to sort of
Yeah.
help women?
Yeah. It's a place that women can go if they qualify, if they are in need, and they have a lot of different resources. They have materials for infants, for infant care. They have food, clothing. There's a lot of different resources where they can like learn how to do resumes and develop something so
That's
in the
awesome.
future they can be working on themselves and being able to provide for their families. So it's mostly an organization that helps women in need kind of get on their feet.
I love that. And that's so important. I mean, they're pushing, they're trying to achieve, and then you kind of give them that next step or that little extra help. It's really important.
Yeah, it really is.
I love it. And then kind of going globally again, like I said, what are some of the biggest obstacles? I know there's so many obstacles that women face, particularly globally, maybe outside the United States, that maybe sometimes we don't even see or know about. Like, what are some of the obstacles that women face globally a lot? I know you've seen a lot of that.
Again, I think a lot of it is about tradition and culture within a society. And
Yeah.
so, and that really goes back to their history,
Mhm.
how their nation developed and the differences between men and women and how those cultures or traditions stayed the same. And just to kind of give it a little example. So
Mhm.
in the US, growing up, I grew up in Central California, and my dad, really encouraged my mom to go back to school, and eventually she did. And so she taught European art history. And I was raised as a Christian. I am a Christian, but I was raised in a Christian family. And because my mom was interested in European art history, she had a real interest in religious art. And so looking back historically at religious subjects, it was fascinating to look at the difference between the Bible characters Adam and Eve, because Adam was always a very strong, capable person. And in most art, at least historically, in most Christian art, Eve is shown as a very weak, guilty, submissive woman, or a sex symbol. So it's interesting. And I think, we grew up kind of having those influences. And so every culture has something in their background around the world that holds women, in a lot of cultures, holds women back as not being a gender equal human being. So for me, it's a concern about our humanity. We really, as a human race, women, should be partners. I just really, I like the word interdependence between partnerships. As couples, or working together as men and women. But in most areas where women are not seen as equal, or they're considered property, there's a lot more violence and abuse, and just lack of opportunity for women to develop or grow in any way that, past where the limit that they're at. And that's hard. I'll just share one quick example that
perfect. Thank you.
Sorry.
No, I love it. Thank you.
One summer when I was working in the Dominican Republic, we would have different groups of about 50 women that we would teach. We had some experimental groups and some control groups, but basically they were all women who they attended on two different sides of Santo Domingo, the capital city. They attended these clinics. And so we were able to recruit them from attending clinics, either because they had children they were coming to have their children looked at, or for something for them. And one group we had, and it was an experimental group, so we met with them twice a week for 2 hours, and we would teach them a new lesson about how to have improved health within the home. And we had a very vocal woman who I just loved. She had a lot of personality, and she would get the women jazzed up, and we had conducted some surveys prior to starting the class with each one of them. We were actually invited to their home. So my students and I, we would be on a street. Sorry, cat crossing.
That is all right. Love it.
We would be on a street, and we would go to their individual homes and sit down with them and have a conversation with them to find out what, how much they understood about sanitation, hygiene, pregnancy, breastfeeding. So this woman who was so active and so fun and vivacious in class, it lasted about 2 months, and about 2/3 of the way through, she stopped coming. So I asked some of the other women where she went or why she stopped, which was fine. They're always allowed to quit at any time, But because she had enjoyed the class so much, I was curious, and I was the one who had interviewed her, so I knew where she lived. So I went to her house just to check in and make sure everything was okay. And she told me that once that her husband said she could come to this clinic thing, but once he realized that she was gaining knowledge, he was not happy with it. And so he told her she could no longer attend. And it broke her heart, because she was loving it. And there was a lot of participatory education going on, because everyone has different ideas. And it was a sad moment, because I realized this is a gender issue, and he doesn't want her to be more educated in any area that he is, which is such a detriment to their family. So that was just an example. There's so many around the globe where women are just at a disadvantage. In some areas, just being born a female, if it's in an area where there's a lot of poverty, they're more likely to miscarry because they don't understand the value of different nutrients, and so they're malnourished starting pregnancy. I mean, you could just go on and on and on. There's so many different ways, and it's a challenge.
Yeah, and I remember learning in international health a lot about like we talked about women's health, just like the things that sort of like experience and culture can lead to. You know, we've talked about like honor killings and bride burnings and
Yeah,
and all those things, and like
a lot of violence.
it can lead to that. And I mean, the fact that gaining an education can have that much of an impact on like sort of getting themselves out of those situations, or allowing them to have better access to healthcare, or like understand more about their bodies and what they're capable of. Like it's so crazy to me, just
Yeah.
the impact that education can have, and also what it can cause out of fear, you know, like you don't want, like you said, her husband didn't want her to learn anymore, and
Yeah,
it's sad to see some of those things. So
it is. It broke my heart. And I could tell she was very, very sad about that. And I thought, what a loss for them, you know?
yeah,
And I
it can
think
be
that's
such
a pretty common
yeah,
thing.
yeah. And so to continue, I know you've mentioned you've done a lot with work with HIV and AIDS work. What are some of the misconceptions that make HIV and AIDS like such a rampant problem, like run rampant in sort of these developing countries? Like I feel like there's so many misconceptions that cause it to just kind of spread like wildfire almost. What are some of those misconceptions?
Really, it's a lack of education that
Yeah,
people have. That's the bottom line. And
absolutely.
also, I mean, before we really understood what HIV was, before it was even diagnosed as a virus, and it was in our population, we started seeing numbers pop up. You know, it's believed that it had been in sub-Saharan Africa since about the 1950s,
Wow. Yeah.
but people didn't know what it was. There was no disease that was actually diagnosed, and so it spread among the population rapidly before we even figured out what it was. That's one concern, but the main issue is lack of education. There's so much fear. At least in Ghana, you're not really allowed to speak openly about sex,
Yeah.
and you don't talk about specific body parts. I mean, when we would teach about HIV, we'd have to use the birth canal instead of saying the vagina, because
Really
you couldn't use certain terms in public.
interesting.
Yeah, it was really interesting. But you know, we also wanted to really make sure that we are respecting their culture and where they're coming from.
Absolutely.
And
Yeah.
so, but you know, they believe there's such a stigma of fear associated with it, that it's all because of sexual sin. And so people don't want to even be diagnosed. Some of the misconceptions were that you could get it by sharing utensils with another person. You could get it from sitting on a public toilet seat. In the schools there, if most of the schools are subsidized by the government, so they're very poor areas, and all of the kids, boys or girls, they have to be shaved their heads to go to school and wear a uniform. So all the girls and all the boys, the barber would just come to the school.
Just
They would line up and just bzz, 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 bzz,
oh
bzz.
my goodness.
So there was a fear that if you got nicked by a barber, you know, if someone got nicked by a barber, you could get HIV, because, you know,
Yeah.
there was just a lot of, when we worked with the ministries of health, when I went to the ministries of health to have them look at my survey, they actually had me add that you can get HIV through deep kissing or French kissing. And I said, okay, well, we know that it's, I mean, you can
Like,
detect
hang on a
it.
second.
You can
Yeah.
detect it in the saliva if someone
Yeah.
is HIV positive, but it's not viable.
Yeah.
So you can't really transmit it. And so we had this discussion, and they said, well, because of poor areas where there's poor oral hygiene, if a boy has bleeding gums and a girl has bleeding gums, there's two open areas for that virus to
Oh my
transmit. Yeah, to
goodness.
transfer.
Right.
So yeah. So, and they also they believe that mosquitoes could transmit HIV, because
Yeah.
mosquitoes would give a lot of people malaria or dengue fever. And so there was just a lot of, they just didn't have the knowledge about what they could do to stay safe, and you know what the risks were. And
Oh man, it's crazy. I love it. I love education. I love being
yeah.
that.
Well, and I'll just
We can
add to
do
that
more.
kind of the difference between male and female and teaching that. Originally, we went and worked with what's called the Goth Tribe, and the Goth Tribe, they they live on the coast. And
Mhm.
so the Goth Tribe, the people are fishermen by trade.
Cool.
And then they trade in the city. And
Yeah.
so anyway, they had this belief that if you were a fisherman and you worked in the sea, you couldn't become HIV positive. Which
Really?
didn't, yeah. So the Goth Tribe, or sorry, the Goth chief was aware that this was a huge problem. Their statistics for HIV and STDs or STIs and teen pregnancy was so much higher than the rest of the country. And so he brought in originally a group to provide condoms to all the men in the community. And so they put them in the pharmacies and they made them like almost free. They had to pay a little tiny bit, but not much.
Yeah.
And it completely failed. Over a couple of years, they collected data and none of the numbers had changed. They'd actually increased. And so they realized that, you know, in going around and visiting with people in the community, they realized that the men felt like, hey, that's not my problem. Like, it is my prerogative to have sex and enjoy intercourse without having to use a condom. So then they shifted their focus on young girls. And so they brought in a bunch of female condoms. And again, the girls were taught how to use them and they were distributed in the pharmacies and the girls weren't using them. And finally, they went out and were trying to figure out why. And the girls, they were so concerned about beautifying themselves. And the female condom has a ring around the bottom and then a sheath, and then there's a ring around the top. And they were going in and buying them and cutting the sheath out and putting the 2 rings on their wrists, like bracelets.
Oh my goodness.
Almost free jewelry. They figured out how to make all it. So you would wander around and you would see these girls with just these rubber rings all the way around their wrists, and they weren't using them for the purpose. So finally he said, okay, let's try education. And so that's when we kind of came into play.
Yeah. Awesome. That's so cool.
Yeah.
It's so fascinating to see just what learning about something can do to help situation. So I love that. Just one final question. I think it's so important with education that we're able to find places to learn, to educate ourselves as well about like what we can do to help women, what we can do as women to help ourselves, kind of a thing. What are some of the best places that we can educate ourselves, or that people who will see this can educate themselves about women's health, would you say?
Well, I mean, Googling anything today, you can find amazing information on the internet. I think, of course, taking a class so you're more aware, but if there's anything you're interested in, there's so much material out there that can help educate you, as long as you find a resource that you know is
reliable resource.
Right, right. Yeah. But there's so many places. I mean, even I work on a committee there's 4 women in South Jordan, and every year we try to do some kind of a service that benefits the community, and sometimes it's just for women. You know, so it'll have something to do with getting things for newborns, or it'll have something to do with I don't know, educational materials for their children, or doing different things. So I mean, and there's a lot of service organizations where you can get involved in helping. But as far as education, I mean, I think what you're doing, YouTubing and letting people hear about these different things, getting online, and I mean, there's so many. I teach a women's health class, and students have to jump online and they watch all of these great documentaries, or like Emma Watson does a lecture that's called He for She at the United Nations, and it's about gender equality, and it's so good. And so just getting out there and educating yourself on especially on issues that you're concerned with, or you're worried about, or interested in.
Perfect. I love it. Thank you. Thank you.
Yeah, you bet. It's been great to talk to you, Hannah.
Thank you. Yes, I've loved this so much. Thank you for your insight. Thank you for your wisdom in all of this, for your experience to be able to share with us. So thank you so much for that.
You bet.
Happy International Women's Day yesterday.
Thank you.
Super excited to be able to talk about women's health during International.
I know, it's awesome.
I think it's super cool. So
and I also feel like just in closing, like
Yes,
every
yes.
woman can stand up and be an advocate themselves in all the different interactions they have in their social circle. They can be a
Yes.
very strong influence. I just feel like there's so much moral influence that women have in society. I feel like women are the glue that keeps families together a lot of times. And, you know, there's so much goodness. And I'm men too. I mean, I have the most beautiful husband, but women can really be strong advocates just for each other, supporting each other and, you know, trying to help each other. And
yeah, I love that women support women. Like, we empower each other. It's amazing. So thank
you. You bet. Thanks for calling.
This was awesome.
We'll talk to you later.
Thank you. Bye.
Bye.